Dr. James Nessing, your Macon, Georgia chiropractor. We're here today. Brand has come in, and what's bothering you today, Brand?
My lower back, it's mainly on the left side, and my left rib cage.
Okay, all right. What we're going to do first, we're going to do a motion palpation scan and find out where her spine is not moving properly. All right, you got a little bit of restriction or blockage on this right SI joint as we come up through your back. You're sore here?
Yes.
And how about there?
No, just the left.
Just the left side, okay. That's your iliolumbar ligament, so the side that's restricted is causing some of that to be inflamed on you. So as we come up through here, you got some restriction up through your middle back and this rib cage on that side. Turn your head to the left. All right, you turn pretty well. Go back to the right. Okay, that's doing pretty good. Let's stand up just for a second. I want you to side bend to the right. Is there any pain or discomfort on this side?
No, just up here.
Feel it pulling?
Yes.
Okay. Bend to the left. Any pain or discomfort on this side?
Down here.
Down through there. Okay. Lean back on the left. Same thing again?
Yes.
Okay. And how about when you lean back on the right?
Just up here.
Pulling in that rib cage again. Okay. All right. So let's do this. I'm gonna work on your sacroiliac joint first. So let's do this. Let's have you come around this way. And I want you to sit and lay on your left side. All right, so what we're going to do first is adjust her sacroiliac joint on this right side. So I'm just going to stretch this, get that just right. Just let it stretch. Good. Now I want you to turn the other side here. Okay, we're going to adjust her sacrum on the right side. Okay. That went pretty good. Now let's turn all the way on your stomach. Just feeling the spinal joints as we come down through here. Okay, take a little breath in. Let all that air out. Let it stretch. Okay, you're going to turn on your back now. And I want you to sit up. And you're going to cross your arms. This rib cage on the left is restricted, so we're going to do an adjustment on that. So lay on the back, your head back, breathe in, blow all the air out, let it stretch. Good, pretty good. All right, let's stand back up. Let's stand again. Okay, I want you to bend to the left. Is that a little better?
Yes.
Okay. Am I going that way?
Yes, so
Okay.
ribs don't hurt anymore.
Okay. Go ahead and lay back down on your stomach. We're going to use an instrument called a percussor to release the fascia down to her iliolumbar ligament. That feels okay?
Yes.
We're also going to percuss the rib cage that's restricted. This releases fascia. Get the mid back going. check your motion. Back on here. Okay, that does feel better. Okay. Thanks for watching today. I'm Dr. Nessing, your Macon, Georgia chiropractor. You can find us on the web at drnessing.com. Thank you very much.